Welcome to EPC Pathshala. My name is Shalila Raj. I am affiliated to School of Social Work in TISS. Today we are going to go through the module 1, Introduction to Mental Health and Mental Illness, as part of the course Mental Health. In this particular module, we are trying to introduce a concepts of mental health, mental illness, a general idea. The structure of this presentation would be introduction about mental health, which includes objectives, understanding of mental health, mental ill health and mental illness. Other things will be determinants and factors that influence mental health, the key concept of promotion and prevention of mental disorder, social worker who is practicing with people living with mental illness, what all things they have to be careful about, and the policies and legislation for mental health in India, and how the implications for policy in mental health and mental illness can be brought out. In India or across the world, it shows that 1 about 10 people have mental disorders, and they receive evidence-based treatment. Not only just mental disorders, but they also receive evidence-based treatment. That means clinically diagnosed. Based on that diagnosis, they have received treatment. So if we have to look at the people who have receiving treatment, it is very less. Many data, many studies have been conducted on the global burden of mental illness, and it is been accepted that mental illness indeed has a huge global burden. What is mental health? When we talk about mental health, it is defined as a state of well-being. Or earlier we thought mental health or as an absence of mental illness. That's a very absolute definition. Mental health is a comprehensive concept which includes not only just the absence of mental illness, but the well-being in which every individual has a potential, and they realizes that they have a potential. So whatever the normal stresses in life, you can cope with it, you can work productively, fruitfully, and is also able to make contribution to your community. So this is what we can define mental health, and this definition is comprehensive enough to project the abilities of the person and how that will help them to cope with the regular stresses in life, and how a person can live fruitfully and contribute to the community. So what will be mental ill health? Just opposite to what mental health is. The spectrum of problems that interfere with an individual's cognitive, social and emotional abilities. So there you can see 3 things. One is cognition, that is the thought process. One is affect, that is the emotion, and the last one is the action. So there is a balance between this cognition, emotion and action, that is mental health, mental well-being. Any imbalance in these 3 components can result in mental ill health. So this mental ill health again can be segregated into 2. One is mental problems or mental illness. One is mental illness, that is a bit more broader component, and mental problems, which are much less severe in nature. What happened is there is a model which says dual continuum model of mental health. As I said, mental illness is quite disastrous, and it can affect every area of life, all the 3 components I mentioned. However, with mental illness, you can have or you can lead a productive life. That is what the concept of dual continuum model assures. For example, we have an optimal mental health with mental illness, where a person is diagnosed with mental ill health, but he can live a productive life. There is optimal mental health without mental illness, that is a normal regular life. Then there is poor mental health and mental illness, where the condition is really bad. Then there is poor mental health without a mental illness. It is not necessary to have necessary to have a mental illness with poor mental health, but we can also have a life without a mental illness but poor mental health. How do we diagnose, or how do we identify a person with mental illness? This is a bit tricky. We have seen the projections of people who are living with mental illness, slightly exaggerated. Not necessary that every individual has to go through all those physical features which are associated with mental illness. An individual is said to be suffering from mental illness when you have 3 things has to be there. 1, the changes in emotions, thinking, speech, behavior. Every activity is related to cognition, emotion and action. That is one part of it. Second, all these changes has to affect them. They have to feel a distress, the person has to feel a distress, plus the person the significant others or the family members, friends or their spouse has to feel that distress. So both the person and the people surrounding him or her has to feel the distress. The third one is this distress should disrupt their day-to-day life. Every activities, the daily life activities, work functioning, family life, social life. So if all these three things are in place, then we can say a person is living with mental illness. So what are the features of mental illness? We said about disturbances. It's not necessary that disturbances has to be in all the three areas. It can be physical. The disturbance can be in sleep, or the disturbance can be in appetite, where people eat less. They don't feel hungry. They eat less. Then they don't have a proper bowel or bladder movements, and the sexual desire and activity is very low or either very high. So it can be the sleep is very high, the appetite is very high. It's not necessary it's always low, but it can be, it's not balanced. That's when we feel that there is a disturbance in physiological changes. But physiological, some people generally doesn't sleep much. Can we call them as a mentally ill person? Not necessary. Then there are psychological changes. Their speech could be difficult. Some people stop speaking, some people speak a lot. Then their behavior towards others, it can be agitated behavior, it can be muted behavior. Emotion, they may express emotion, they may not express emotion. Perceptions may change, their memory be affected, the intelligence and decision making level goes down, and the level of consciousness also falls down. It's always better to go and check the DSM-4 or ICD-10 to understand the categories of various mental illness, which is segregated based on these speech, behavior, emotions, perception and memory, intelligence, etc. So we can get an idea about what kind of mental illness fall under which category, because there are organic functional mental disorders and then there are functional mental disorders. Then changes in individual and social activity. This is where we have to be very careful, because people who have mental illness can have a good mental health if the functions, if the individual lead a good social life, we can say it's a better mental health. But if it is disrupting their daily life activities, we have to be concerned. Activities of daily life means brushing, personal hygiene activities, self-care activities, maintaining their private space activities. More than that, withdrawal from friends and family, that is much more of a concern. Don't misunderstand a person who doesn't take a bath a day or two, or some people generally they don't prefer to take bath every day. That is not mental illness. But over a period of time, consistently losing interest in taking care of oneself is a concern. What are the determinants and factors that influence mental health? Mental health or mental ill health, there should be some determinants. It just cannot come like that. There should be some aspects that may that are associated with developing a mental illness. We can categorize it into three: structural level factors, community level factors and psychological and individual level factors. These three factors can also be the contributor to developing a better mental health. So in structural level factors, we can see social and economic cultural factors that are supportive of mental health. For example, you have a safe living environment, you have every basic facilities closer by, you have a good employment, you have education. So these are the aspects that will help you to attain a better quality of life, though you are living with mental illness or you have some mental health problems. Community level factors. This community level factors is slightly tricky, because community differs for every person, or it differs according to the place we live in, it differs according to the community group we belong. But it is essential to have a community support, to have a sense of belonging. We all have to have that sense of belonging to have a better mental health. In order to live an active social life, you need social support, you need social network, you have to embrace the diversity surrounding you. For example, support groups. A person living with mental illness can feel better and can relate more if they have a support group. And then support from the extended family, their friends. This is also very much important in a community level aspect. There are certain individual and psychological level factors. It is not necessary that the help has to come from the outside. A person can get help from within. like their ability to manage the thoughts and emotion. Okay, I have mental issue, I have a mental illness, I have mental health problems, I have a lot of negative thoughts, but it is my decision to allow these thoughts to rule or not. For being assertive than reactive, using the emotional intelligence. Here is where we actually depend on the emotional intelligence to segregate which emotion is required and which emotion is not required. Let us go to the promotion and prevention. Promotion of mental health and prevention of mental disorder. What do you mean by promotion? By promotion, we mean that we have to build a healthy public policy on mental health by creating supportive environments, by strengthening the communities to take action to support people who are living with mental illness or support people who have mental health problems. Developing personal skills in the sense life skills, social skills, vocational skills. So these type of skills which will help us to acquire a better life or develop a better social support has to be managed. It can be through psychosocial rehabilitation for a person living with mental illness, or through the government by drafting policies which support people who are living with mental illness. There are certain concepts in promotion of mental health and prevention of mental illness. What are this? Primary, secondary and tertiary. You might have been familiar with the terms primary, secondary and tertiary. As the name constitutes, primary prevention. What is it, the primary prevention? The idea is, how can we prevent the mental illness from occurring? It's better to prevent the mental illness through universal action. Like if you can launch a program into the population and help them from getting that far to a mental health issue or a mental illness. So primary prevention focuses on preventing the onset of mental illness. How can we prevent from the mental illness occurring? So that is what primary prevention mentions. Secondary prevention, there is a chance of developing illness, or the illness has developed, or there is a first episode of illness. In that case, we have to lower the severity of the episode, or lower or cut short the duration of illness. This is possible only through early intervention, by identifying that this is a mental health problem and this needs some support. So this can be again two. One is prevention focused. When the person is feeling, for example, in a mental illness, it is assumed that the first symptoms would be lack of sleep or lack of appetite. If it is prolonging, identify it and focus and treat that itself. That way you can actually prevent that illness from growing into a full-blown mental illness. Treatment focused. Unfortunately, the mental ill episode occurred. What to do then? To treat it and prevent it. That is secondary prevention. Let us go to the tertiary prevention. Here, the person has gone through many episodes. Onset is once, and then it is called as episodes. So episodes of illness. In such cases, what we can do is make accessibility towards treatment feasible, affordable, accessible, and then motivate for psychosocial rehabilitation. As I said, many of the mental illness can result in functional dysfunction, functional disability. Therefore, in that case, the medicine may not be able to restore the skills you have lost. In that case, psychosocial rehabilitation is what is required to restore the skills which were impaired. And relapse prevention. It's always a chance of relapse. Once you got the illness, you took treatment. Unfortunately or fortunately, it happened again with medication. Again, here that's called a relapse. So that relapse has to be prevented. So this can be through ongoing medication, consulting a regular follow-up with the psychiatrist or mental health professionals, and also trying to keep the stresses away and learn the skills to face the life in a better way. This is a topic which we have to be a bit careful about, how social worker has to work with people living with mental illness. First thing, mental illness, in the context of a mental illness, you cannot make a promise that it will be treated, and it will be treated and cured. Treatment, yes, we have, but cure, no one can assure. So don't make any false promises to the patient or the family that this can be cured. It's always better not to criticize or blame the patient or the family, because mental illness is no one's fault. It can happen to anybody at any time, anywhere. What we have to, as a social worker, we have to do is to strengthen their abilities to cope with that illness, not to criticize them. Support for family members, not to support the patient but also to make important decisions in terms of treatment, decision in terms of psychosocial rehabilitation. Treatment, people come to the hospital, take medicines and they go home. What they forget is that psychosocial rehabilitation is part of it. So making the family understand that and go for it is a social worker's responsibility, but without playing the blame game. Be sensitive to the gender component. Gender why is it important? Because in our context, in our social structure, male, female, male patients, dealing with patients for a longer time alone could be a problem. So this sensitivity we have to keep. See that they develop a confidence in their abilities. As a social worker, it is not just guiding them or not just helping them, but instill a sense of confidence in them. That can be done over a period of time by gaining their trust, by making them feel that they are valuable. At the same time, it's also your responsibility not to make the patient or the family depend on you. What we are trying to do here is to empower the patient to take decision on their own, or take the decision on their own, as well as lead an independent life, but not by depending on the social worker for everything. So this is something every social worker has to be careful about. Last thing is, the patient has to take medication along with the counseling and other therapies to help in recovery. Medication is important. As long as the doctor says not to stop, the patient has to continue with the medication, and this is social worker's responsibility to keep reminding them how important medication is. Let us go to the policies and legislation for mental health in India. If you look at the history of mental health policies or the law related to mental health, in 1912 we had the Indian Lunacy Act. After that, in 1987, we had National Mental Health Act. Before that, in 1982, National and District Mental Health Program. National Mental Health Program in 1982 and District Mental Health Program in 1996 were the milestones milestones in the policy and legislation for mental health in India. Why it was a milestone? Because this is the first time they have ever focused on the prevention, promotion and curative aspect of mental health. Earlier it was always the curation. You got the mental illness, you put them in mental mental hospital, which was earlier known as asylums, which from that 1982, from that 1987 Mental Health Act, the term was reconceptualized as mental hospitals to reduce the stigma. So the attempt was to prevent, promote and curative aspect. The main objective was to reduce the disability, distress and exclusion, morbidity and premature mortality associated with mental health problem across lifespan of a person, maybe the child or adolescent, adult, youth, adult or elderly. The National Mental Health Policy announced in October 2014 was based on the value and principles of equity, justice, integrated and evidence-based care, quality, participatory and holistic approach to mental health. The concept from prevention, promotion and curation aspect changed to equity and justice, and that is when they realized that there should be an integrated approach with evidence-based care. The quality of the treatment, quality of the care has to improve. Along with that, the participation from the person living with mental illness, the family, the community is required for a holistic mental health approach. If you look at the legislations which has some aspect to deal with mental health, we can say there are n number of act which has some or the other thing to do with the mental health aspect. For example, Narcotic Drugs and Psychotropic Substance Act 1985, Mental Health Act of 1987. Now it is from 2017 we got the Mental Health Care Act, which predominantly deal with the right of the mental ill person to accept treatment or not. And also we have a clarification on what are the rights and responsibilities of the social worker or the mental health professional who are working in this field. Rehabilitation Council of India Act 1992, which clearly specifies the ways in which rehabilitation has to happen for the person living with mental illness. Person with Disabilities, Equal Opportunities, Protection of Right and Full Participation Act accepted disability from mental illness as part of disability. National Trust for Welfare of Person with Autism, Cerebral Palsy, Mental Retardation and Multiple Disabilities Act, Protection of Women from Domestic Violence Act 2005. These are a few legislations which deals with mental health in India. What is, when we talk about mental health implication for policy, what are the constraints? Let us talk about the constraints first. There are no trained staff. There are trained staff, but it's inadequate. Everything, manpower is inadequate, resources are inadequate, counseling and psychiatric services are inadequate. Unless and until we have more of manpower, we have more resources and accessibility to resources for everyone from the grassroots to the elite, and availability of counseling and psychiatric services in every state, every district, every panchayat in fact has to have to reduce the impact of mental illness in the society. So we need a comprehensive policy for prevention of mental illness and promotion of mental health. Comprehensive in the sense that it has to have all the three aspects which we have studied: prevention, primary, secondary and tertiary. The mental health policies in the country, we have already discussed about the mental health policy. What is the problem? We already have a lot of policies. How is it implemented? That is the question. It is not the drafting of the policies that makes or that matters. How effectively it is implemented, how much fruitfully it is accessed by the people who actually needed it is what makes more important. To conclude, how can we recover, or how can we help a person to recover from mental illness? One thing we understood that it is an episodic process. In some cases it can be one episode and then it never occurred. But unfortunately, that is not the case with majority of the people living with mental illness. After the onset, it keeps on going. The episodes may come, go. There are other things also. With discontinuation of medicines, then follow-up is poor. Sometimes even if you have medications, you are very consistent with medications, consistent with follow-up, you go for psychosocial rehabilitation, relapses can occur. This can be associated to the stressful factors which is extraneous to the person. In such cases, what can we do? One thing we have to understand is recovery is a process. It's not a one-time activity, or it's not a one-time goal. It's a long-term goal which has to be carried out over a long period with support of the state, with the support of the family, with the motivation, self-motivation of the individual who is suffering from mental illness. So in order to summarize this session, we have gone through the objective of this module. We have seen that it has to the idea was to introduce the mental health concept, mental illness and mental health problems, what is the difference and what are the determinants, how can we prevent it, and how effectively can the policies be implemented. One thing and obviously most importantly, how the social work has to deal with the person living with mental illness. From whatever we have covered, we can understand that the mental health situation in India, it's still in a stage which is evolving. It is evolving in order to integrate the individual, the community and the state. We have come far from a state where there were just one policy and some guidelines that would motivate or that would help people to deal with mental illness, to a state where we have many things to look at. We have prevention of aspect, we have curative aspect, and then we have promotion aspect. So in order to understand mental health as a concept, we should also understand the social cultural aspect of a country, of any society. Because mental health also depends upon the cultural aspect and the society we live in. So as a social worker, whenever you have an intervention, you have to focus on the social cultural perspective or the social cultural aspect of the person, and then try to integrate what all we learned from the session. This would bring a much more effective outcome rather than going or following only the biomedical model or trying to bring in just the psychological aspect. It's always better to have a biological, psychosocial and now we call it as a community integrated approach. Thank you.